My name is Caulin Booher, and I'm a freshman at the University of Cincinnati's College of Nursing. Modern-day nurses have responsibilities and characteristics that shape them into the best caregivers possible, both physically and emotionally. As nurses, it is of the utmost importance that we have a good relationship with ourselves through self-care practices. Practicing health and wellness should be of second nature to those in the medical field, as they are required to deal with it daily. Going into the workforce, we must learn and exhibit these mannerisms thoroughly in order to assist those who are dealing with various illnesses. At the airport, they tell you to secure your oxygen mask before helping others. If we are not equipped with the tools to combat mental health issues, we will not be ready to teach about these health and wellness techniques to others, nor will we be able to establish healthy relationships with our patients. One of the most important recommendations of the Future of Nursing 2030 pertains to the issues surrounding health equity in our community. According to Mary Kay Wakefield, a co-author of the article The Future of Nursing 2030, Charting a Path to Achieve Health Equity, notes that health inequities, defined as systematic differences in the opportunities that groups have to achieve optimal health, leading to unfair and avoidable differences in health outcomes, disproportionately impact people of color, the lesbian, gay, bisexual, transgender, and queer community, people with disabilities, those with low income, and those living in rural areas. We are likely to see patients from diverse backgrounds, no matter the location. However, some areas are riddled with health and economic disparities alike, preventing certain people from getting the top-notch care that they deserve. While it may feel like this problem is far out of our reach, there are steps that we as nurses can take to assist those in underprivileged areas. For example, holding low-cost or even free classes and sessions to explain the importance of physical and mental health may help families everywhere understand health care objectives better, possibly saving them trips to the doctor's office or hospital. Discounted exams in underprivileged areas may also help those unable to get to a health center, whether it be due to issues with transportation, insurance and copays, or family conflicts. Health inequity is a widespread problem that has tormented the United States for many years. By taking smaller steps and building awareness in our community, we can eventually create a movement that will change the future of nursing forever. This recommendation resonates deeply with me because I have witnessed firsthand some of the health disparities that exist within not only our community, but our entire state. Growing up with relatives in and out of the hospital, I have unfortunately had to watch others struggle to get proper care. These experiences were heartbreaking. I wanted so desperately to fix their situation, but always felt as though I was too small to make an impact. With a professional career in the nursing field, however, I can finally do everything in my power to break the health inequity barrier. Whether this be through teachings and knowledge or discounted services, I believe that I can do my part to minimize the health gap seen in our community today. I wish to be known as a nurse that will prioritize the health of my constituents, no matter their background or situation. I am committed to utilizing my tools to the best of my ability in order to decrease health disparities in America today and provide the highest level of care possible in a professional and engaging environment. In order to develop into a future well-rounded nurse, I certainly have some steps to take. As nurses, we should make it a priority to establish connections with our patients in order to build trust and better treat them during their stay. This requires us to work on certain personality traits. A nurse must be outgoing and personable in order to create the rapport that I mentioned earlier. Working on these skills through exercises similar to that of the talking tree will ensure that I have the applicable characteristics by the time I begin work in a professional setting. Many nurses enter the field not having practiced any amicable personality traits, creating an undesirable environment for both the nurse and patient alike. By training ourselves on these important qualities now, we will surely be ready by the time we interact with patients. Nurses have to be both strong-willed and self-fulfilled in their work. Qualities such as metacognition and self-recognition require nurses to evaluate their own shortcomings and make adjustments where they see fit. This will create a generation of more self-aware and hardworking nurses, able to adapt and persevere through the daily obstacles and struggles of life in the medical field.